The statistics are startling. Heart disease is the #1 killer in women, claiming more women's lives over age 65 than all other cancers combined. As for breast cancer, a woman dies from it every 68 seconds. And when it comes to women having healthy babies, Tennessee receives a failing grade, with one of the highest rates of premature births and low birth weight babies in the nation. In fact, 14 babies per week die in Tennessee before reaching their first birthday. So, what steps can you take to have a healthy baby? How can you lower your risk of heart disease or detect breast cancer at its earliest stage when cure rates are highest? Welcome to Medical Advances, Insights into Women's Health. Hello, I'm Sylvia Castañeda, and during the next 30 minutes, we'll turn to experts in women's health to help arm women and their families with information that can improve and even save lives. But first, we have the latest on screening for cervical cancer. The human papillomavirus is the most common sexually transmitted infection, and it's linked to cervical cancer. The American College of Obstetricians and Gynecologists recommends all women 30 and older should have both a traditional pap smear plus a human papillomavirus or HPV test. This test looks for HPV strains which cause 70% of cervical cancer.
And if they both come back negative, we can allow a 3-year interval on the testing.
Dr. Bruce Beyer is the medical director of the Center for Women's Health inside Vanderbilt Health at 100 Oaks. Dr. Beyer says if an HPV test comes back positive,
then we can watch a woman more closely to make sure that she doesn't get cervical cancer.
The Center for Women's Health is in a unique position because it not only offers patients easy access to screenings, but also offers access to clinical trials and state-of-the-art OB/GYN care normally found on hospital campuses.
And this has great advantage to the patients because they can come here from anything from a urogynecologic problem to a pregnancy issue to a menopausal issue.
Some of the latest techniques in women's care are available through the center, such as a pregnancy prevention procedure done in the doctor's office in just minutes. Specialists can use one of these two inserts to prevent pregnancy. This one is a nickel titanium coil. The other, researched at Vanderbilt, is made of silicone. No surgical incision is required. Specialists just go through the cervix and place either insert directly into the fallopian tube.
And then over time, it causes the tube to close down, which then makes it impossible to get pregnant.
Another minimally invasive procedure is called a laparoscopic supracervical hysterectomy.
The technique can be done through an abdominal incision that's rather small, and the uterus can be taken out, and in some cases the ovaries and the tubes can be taken out.
This procedure must still be done in an operating room, but women can usually go home the next day with less pain and downtime as compared to a traditional hysterectomy. Services like imaging are also performed in the center, or right next door is the Center for Women's Imaging, which focuses on obstetric and gynecological ultrasounds, including scans in 3D and 4D. When it comes to prenatal care and delivery, women here can choose to meet with their obstetrician or follow a growing trend, an integrated team approach involving specialists and certified midwives who offer a unique touch.
It tends to be a very gentle approach to women's health care. It tends to be as non-interventional as is possible.
But if intervention is needed, let's say during delivery, specialists are on hand to help. If a complex issue is spotted during a prenatal visit, maternal fetal medicine specialists are just down the hall at this facility. And if specific health issues are detected, such as diabetes during pregnancy or a concern that the fetus isn't developing normally, there are specialized clinics within Vanderbilt where women can be offered specialized care. Healthy babies are not only a priority for expecting mothers. Tennessee ranks 47th when it comes to infant mortality, meaning more babies die here than in almost any other state in the nation. Experts aren't sure why. So that's why the state is funding innovative programs to try and change these alarming statistics. One of those programs is right here at Vanderbilt.
Seth, come on! Come on, Seth.
Sarah Katz, a mother of 3, let her obstetrician guide her through prenatal care during her first 2 pregnancies.
I was very young. I didn't have a lot of information given to me.
For her 3rd pregnancy, Sarah and her husband Shane drove an hour to Nashville to participate in Centering Pregnancy. It's not a birthing class. This is prenatal care, only in a group setting.
The pieces of traditional care are there, they're just done in a different way. Tell me this baby's name again.
Well, if it's a little boy, we're going to name it Elias. And if it's a girl, we're going to name it Evelyn.
Deborah Wage is a certified midwife and assistant professor in the Vanderbilt OBGYN department. She oversees a state grant for centering pregnancy in the Department of OBGYN. Here's how centering works. 10 or so women with similar due dates meet for regular visits in one big room. Each, with the help of a partner, takes and charts her own vitals like blood pressure and weight.
I feel the baby's head down.
An obstetrician, OBGYN resident, or certified midwife then conducts prenatal checks and measurements behind the screen and can take brief questions just like in a traditional OB visit. If an additional exam is needed, it can be done right after class.
We provide education. We help them to discuss things that are bothering them. We show films and DVDs, and there's books, and there's charts, and there's models.
Okay, I know some people are having girls in here, but if you were having a boy, if you would circumcise or not circumcise your boy.
Lessons covered range from nutrition, the dangers of smoking, to breastfeeding benefits. After the lesson, a health provider stays to facilitate group discussion about that topic or any other concerns about pregnancy or motherhood, from sex during pregnancy to postpartum depression.
And we have women who come to our groups who have had 3 or 4 children, who have a huge amount of information and wisdom that they can give to another young woman who's maybe having her first baby. And so when you let that roll and develop, you nurture and encourage an incredibly empowering experience.
Data spanning 10 years finds centering pregnancy makes for healthier outcomes because of lifestyle changes pregnant women make after attending class.
We have found that that has contributed to decreasing the number of tiny babies that are born too early and too small.
As for Sarah and Shane, they were a bit skeptical about centering at first. But the more Shane listened to women discuss issues impacting them during pregnancy,
I became more open-hearted about everything. I listened more, I paid more attention. I saw what was going on.
Sarah wasn't sure she'd like being in a large group, as pregnancy makes her moody. She never missed a class.
I loved coming up here. I looked forward to coming up here and talking with the girls and talking about new things that they needed to know.
And she did feel empowered when asked questions by first-time moms and loved the unique bond centering created.
I feel closer with my doctor, closer with my nurses and the girls that were in here.
It's brought us a lot closer together.
Plus, Shane got the experience of a lifetime.
I got to help deliver my baby, and that was the best feeling that I think I've had ever.
Coming up, what's the best way to screen for breast cancer? Tests, even treatments tailored just for you. Next. Talk to any woman and you'll hear how breast cancer is something she fears. Yet U.S. government statistics find nationally, 4 out of 10 women have never had a mammogram. In Tennessee, the numbers show 3 out of 10 women aren't getting screenings. And in Davidson County, it's actually 4 out of 10. So when should a woman start being screened?
Snug you up here real close.
For women who don't have a lump or other breast issues, the American Cancer Society guidelines recommend annual mammography screening starting at age 40.
For women who are at higher than average risk or have other complicating factors, then they may begin screening earlier than that, for instance 35, or in women who may have a very young first-degree relative with breast cancer, we may begin screening earlier than that.
Dr. John Huff is the director of breast imaging at Vanderbilt Breast Center, the most comprehensive state-of-the-art breast center in the region. The center provides screening, diagnosis, and treatment for breast cancer. Dr. Huff says there are breast cancer warning signs women should not ignore, from a lump, discharge from the nipple, to skin changes that are persistent.
We can see the edges of it and better define its relationship to the adjacent breast tissue.
Dr. Huff sits on a national panel which establishes and updates guidelines for the screening and treatment of breast cancer. The panel finds annual mammograms are key in early detection.
As we look at mammograms on women over intervals, 1 year after another, and compare those mammograms from year to year, that gives us an opportunity to find subtle abnormalities that we may not be able to recognize on a single mammogram.
And digital mammography, like what's used at Vanderbilt, is a vital tool.
It's more sensitive for detection of breast cancer in women with dense breast tissue and in younger women.
If a woman needs further evaluation, additional mammogram images may be ordered, followed at times by ultrasound, which can determine the difference between a benign cyst or solid lump that could be cancer. A more sophisticated imaging tool is breast MRI. It's used in conjunction with mammography for patients at high risk and can help detect subtle tissue abnormalities indicating cancer. Breast MRI is also used once a breast cancer is detected to help determine its extent so doctors can better plan treatment options.
I think the most important thing that we can offer here is the one-point access in one location, so that the woman doesn't have to go to one facility for a screening mammogram, then go to another location for a diagnostic mammogram, and then to another location for an ultrasound examination, and then to another location for a breast MRI.
So if a breast cancer is detected, what's the next step here? As one woman learned, a personalized treatment plan.
I think they're through blooming, so we can cut them way down.
Between yearly mammograms, Nurse Kay Curto always checks her breasts for lumps. She remembers the day she felt something that alarmed her.
It was pretty palpable. It was pretty out there.
Kay has fibrocystic breast disease, which causes benign lumps, but this latest lump seemed different. Mammogram results came back negative for cancer, but Kay wasn't convinced, so she pushed her doctor for more testing. New results brought a new diagnosis: cancer.
I was scared to death at first, of course. What's the matter, huh? What's the matter with you?
Her tumor was large and had spread to the lymph nodes. She knew she wanted a second opinion on how to move forward. For decades, Kay had worked in top hospitals in Los Angeles, so she was familiar with quality care. She narrowed her second opinion choices to MD Anderson Cancer Center or the Vanderbilt Breast Center, and after researching both.
Vanderbilt, I cannot tell you how great it is as far as the whole picture. And I think I can be very objective because I am an RN.
Kay came to the breast center to learn more about her tumor and treatment options.
This is a place where we recognize subtleties.
Dr. Ingrid Mazoy is the center's clinical director. She says it's important for women to seek a second opinion in a facility where breast cancer is dealt with on a daily basis. Here you'll find staff ranging from radiologists, surgeons, radiation oncologists to medical oncologists who use a team approach to diagnose and treat patients.
There are many ways of treating breast cancer because we actually find that breast cancers are very different from each other. And so what we're trying to do now is individualize care for each patient that comes through.
If they choose, patients here can meet with the various specialists who will be administering their treatment.
And the big difference is that they had HER2-positive disease and had a phenomenal response to anti-HER2-based chemotherapy.
The majority of patients who undergo surgery also have their cancer discussed in a weekly tumor conference.
Even though each individual patient may not have seen the entire team of individuals, they are getting input from multiple surgeons, multiple medical oncologists and radiation oncologists at this tumor conference as we look at their pathology after their surgery. We look at their mammography, make sure we haven't missed anything.
Ms. Curto?
Hi. As for Kay, she had additional tests.
And so you had an ultrasound and additional mammograms, is that correct?
And then met with Dr. Mazoy, who did a thorough physical exam and then shared the results.
It had not spread anywhere else, and so this is certainly a curable cancer still.
Kay also sat down with Dr. Huff to better understand her diagnosis. And she was impressed that patients could meet with the medical team at the same time to discuss treatment options.
I didn't have to make an appointment with this one and come back. It relieves so much of the apprehension. And, you know, they all talked to me about what their part would be. And so it was all done the same day. So when I left there, I felt much more comfortable about the process.
Kay chose to enroll in a clinical trial to see if a chemotherapy drug could shrink her large tumor prior to surgery. She then underwent surgery to remove the diseased breast and nearby lymph nodes, followed by more chemotherapy and radiation. Once treatment at Vanderbilt finally ended.
Actually, you kind of go through a withdrawal after seeing all those people because they become like your family.
Kay credits her new family with saving her life.
And I'm looking forward to a long life, really.
And she encourages women not to be complacent if something just doesn't seem right.
And if you suspect anything and you're not happy with the first go-round, then pursue it. It makes a difference in your life survival.
Coming up, your symptoms of fatigue and stress could actually be signaling a life-threatening condition. Details next.
This artery right here.
Can you relate to these symptoms? Stress, fatigue, anxiety? Could these be a product of your busy lifestyle? Or could they be warning signs of the #1 killer of women, heart disease? Janice Williams is a busy mom, trying to keep up with her job, housework, and kids' schedules. So being tired was nothing new. But she started noticing how winded she'd become doing simple things like vacuuming.
I couldn't even finish the first floor. It was a case where I had to stop several times just to catch my breath. It's your clean clothes, all right, hon? Gotcha. Okay.
And when lifting things like laundry, she'd notice tightness in her chest.
Pretty much just would blow it off for whatever reason.
Janice finally mentioned her symptoms to her doctor during a routine checkup because deep down she thought maybe her body was trying to tell her something. She was immediately referred to Vanderbilt Heart, a comprehensive clinic focused on prevention, diagnosis, and treatment of heart disease, located inside Vanderbilt Health 100 Oaks.
And this is her diagonal branch coming off right here, and you can see there's a very narrowed area right there as well.
Dr. Emily Kurtz is the medical director of preventive cardiology here. She says too many times women ignore symptoms which can signal heart disease, like chest pain or
shortness of breath, strange nausea, in particular a relative decline in their exercise tolerance.
And Dr. Kurtz stresses women don't realize that by age 20, there are numbers they should know which are vital to their future heart health.
Women should really know their numbers, that is, their blood pressure, their weight, their cholesterol fractions.
Dr. Kurtz says that's why annual physicals are important.
So as providers, we have to do two things. Number one, we have to educate women on heart health risk. And number two, we have to empower women to take control of their health, to endorse heart-healthy lifestyle habits, and to modify major cardiovascular disease risk factors because, in large part, much of cardiovascular disease is preventable.
When it comes to a heart evaluation, Dr. Kurtz says a personalized approach is key.
Does she take any medicine for blood pressure or cholesterol?
Patients like Janice have a thorough medical history taken, which includes any family history of heart disease. An extensive medical exam includes blood tests to look for key markers that signal risk, like high cholesterol levels, to tests like an electrocardiogram to look at the heart's electrical activity, a treadmill test to evaluate the heart's performance during exercise, to a coronary artery calcium scoring test, a CT scan which pinpoints plaque buildup in arteries. In Janice's case, the scan found numerous white deposits, calcified plaque.
Her risk of having a cardiovascular event, such as a heart attack or sudden cardiac death, over the next 24 to 36 months was approximately 1 in 3.
I was shocked, yes, but knew realistically that I had to do something about it.
The recommendation: bypass surgery. Janice underwent surgery and is now on medication to control risk factors that cause plaque buildup. Research finds cholesterol-lowering drugs can keep plaque stabilized, lowering heart attack risk by 30%.
How are you doing with your carbs as far as blood sugars?
Janice also met with a Vanderbilt heart-registered dietitian to learn about changing her lifestyle. The goal? To make exercise, weight loss, and a good heart-healthy diet a priority without giving up foods she loves.
Low carbs, very low fat.
Now Janice reads food labels to watch for sodium content and cholesterol. Food is even labeled Mom at home, so everyone knows it's heart healthy. In the months since surgery, Janice has already dropped 25 pounds and improved her blood pressure, blood sugar, and cholesterol numbers.
It's people like Janice that make doing preventive cardiology really rewarding because we get to keep someone who is healthy. We get to keep them from having a cardiovascular event.
I'm a success story. I feel 10 years younger. I have more energy than I have in ages.
Her advice to other busy moms who are experiencing chest pain or fatigue? See your doctor now.
We have to do it for ourselves. We have to take care of everyone else, but first we have to take care of ourselves so that we can take care of everybody else.
Although prevention is the best way to care for your heart, there are other treatments available if you have a blocked artery. Some blockages can easily be treated with a balloon procedure to reopen the artery, followed many times by placement of a stent, a wire mesh tube to keep that artery open. The latest stents are drug-coated. Vanderbilt researchers were instrumental in determining whether these new stents could prevent arteries from re-narrowing. Medical Director of the Cardiovascular Intensive Care Unit, Dr. John McPherson, says the research findings prove these new stents are helping patients.
Those are widely used now in probably 75% of all stent cases in the U.S. They have shown a dramatic reduction in the need for repeat procedures after an angioplasty and stent placement where we open a narrowed artery.
And when it comes to more complicated cardiovascular procedures, the best possible treatment may be offered inside a hybrid operating room.
It is an actual cardiac surgical operating room that is located here in our cardiac cath lab. And we may be the only institution in the United States in which that's the case.
This high-tech OR allows cardiologists and surgeons to work closely together to determine the best course of treatment for the patient. The real-time imaging equipment shows when the blockage has opened, reducing repeat visits to the OR and often allowing less invasive procedures, which really benefits patients.
They have less trauma to their body, less healing that needs to occur, and they go home faster, recover quicker.
Vanderbilt specialists are also offering a leading-edge treatment to preserve brain function after sudden cardiac arrest. Susan Huckabee remembers how early one morning she heard her husband Rob moaning in bed and thought he was dreaming. She tried waking him.
And I looked at him, but his eyes were open and he wasn't blinking, he wasn't looking at me. And so I realized something was wrong. And so I jumped on top of him and began CPR.
Rob was in cardiac arrest due to an undiagnosed heart arrhythmia. During cardiac arrest, the heart stops beating, blood circulation stops, so the brain isn't getting much needed oxygen.
After about 4 minutes of deprivation of blood flow, the brain can suffer a permanent injury.
For years, doctors believed brain injury occurred during those initial minutes after cardiac arrest. But studies now show many times permanent brain injury may not happen for up to 24 hours. In Rob's case, his son Philip and a neighbor continued CPR until paramedics arrived and shocked Rob's heart back into rhythm. He was rushed to Vanderbilt, where specialists offered hope for Rob's risk of brain damage.
So what we've developed is a technique called therapeutic hypothermia, in which we take a patient who's been revived after cardiac arrest but who is comatose with a suspected brain injury, and we cool their body temperature down to a very low temperature, approximately 89 degrees. We have to do this in a very controlled fashion to keep it safe for the patient.
That's because patients run a risk of infection, bleeding, and a shift in electrolytes, which can cause dangerous heart rhythms. So how does staying in a cool state for up to 24 hours protect the brain?
When you cool the core body temperature down, the metabolic activity, the needs for oxygen and blood flow to the brain goes down. And in addition to that, the inflammation that can occur after an initial injury that can lead to devastating injury is blunted by cooling the body temperature down.
Rob's family agreed to treatment, and once he woke up after treatment,
he mouthed the words, "What happened?" And so that let us know, his thought process and thinking was probably going to be okay.
Well, and it's probably a church that's as close to being like this one.
Just weeks after his near-death experience, Rob's back to work as executive pastor at his church.
I feel great. I'm not ready to go out and run yet, but maybe next week.
During the last half hour, we've shown you how clinics here at Vanderbilt Health 100 Oaks are offering innovations in healthcare for women and those they love. A team approach, coupled with the latest in techniques and technology, are improving, even saving patients' lives. For more information on the services offered here, visit vanderbilthealth.com/100 Oaks. Thank you for joining us. We'll see you next time.